AstraZeneca is absolutely safe. We're giving it to in fact, we've got a COVID AstraZeneca clinic today at our surgery. What we're talking about is the difference between causation and actually being associated with something that happens. So as I understand it, there have been 30 blood clot type events in 11 million doses of AstraZeneca vaccine. And in all the trials, there was no demonstration of any problem with blood clotting. It's not biologically plausible for there to be a problem with blood clotting. It's a vaccine like any other vaccine, like the flu jab. And what happens is if you have 11 million people given a vaccine, things like blood clots happen randomly. And the extreme likelihood is that these are people who happen to have a blood clot for another reason, who happen to have had a vaccination in the 2 or 3 weeks, because some of them were not exactly related to the time. So my understanding is that the World Health Organization have said it's safe, all the countries have said it is safe. There's an abundance of caution when you have a new vaccine, so I can understand why some of the countries have suspended use of that particular batch. But I'm absolutely confident that the AstraZeneca is safe, and as I say, we are using it in this country. It's our main vaccine now, I think, Kath, isn't it?
Yeah, absolutely, and I think it's important to sort of say as well. It is a new medicine, it's a new product, so it's got a whole regulatory background behind it. So anything that comes up with any medicine that you take or any other vaccine, we've got the MHRA yellow card system whereby that's recorded and it's very cautiously monitored, etc. So, and like my old professor at Liverpool, he's not that old actually, but he actually heads up he's the chair of the on human medicine. So they take it very, very seriously, and that's not just for the COVID vaccine, that's for medicines generally. So I am really assured that, and again, fantastic explanation of causation. Like, so just because two things happen at the same time doesn't necessarily mean that one is related to the other. So, but it's a really safe, effective vaccine, and we are getting evidence coming forward that it is showing us it's helping with the transmission as well. So it's just so important to get out there and get that vaccine when you get called for it.
I think that's the key thing with the AstraZeneca, that we're starting now to see some evidence that it does reduce transmission. We already know from the trials, and it's starting to come through now, that if you have the AstraZeneca or any of the vaccines, actually, you're very significantly less likely to get disease, but your chances of being unwell enough to need hospital admission or to die are very, very, very low. And if also they are reducing transmission, then you're starting to protect other people around you as well. So it's really is a good news story in terms of the vaccination.